Greetings, comrades. The essence of CBT is it explores the way we think and the way we feel affects our behaviour. And in the case of pretty much any mental health issue, if we have negative thoughts and if we have negative feelings, then that will contribute to maladaptive behaviour. Now, in the VCE course, the CBT gets two mentions. First of all, we need to be able to apply it as a psychological form of intervention for treating a phobic disorder. And we also need to more broadly explain how it can be used as a protective factor in enhancing well-being. I'm going to focus on the phobia in this clip. Now, when responding to an exam-style scenario that requires you to explain how CBT would be utilised as a psychological form of intervention for treating a phobic disorder, such as spiders, we need to take a three-step approach. Step one, we deal with the cognitive component. And this has two subparts to it. So the first part is to conduct a cognitive appraisal. And when you are appraising something, you are gathering information. So therefore, through the use of a diary, maybe through conversations with a therapist over multiple sessions, we identify the triggers, the negative thoughts and feelings about the spiders. It could even be basically going back to the actual origin or the precipitation of the phobia. Once we've got all that intel, then we're in a position to move to the second part, and that's to basically aim towards cognitively restructuring. Now, this requires a bit of work. We might need to conduct a few little minor experiments. We might need to do a bit of research about venomous spiders in the household, etc. And as a result of that intervention, then we're in a position to reappraise and downgrade our negative thoughts and feelings about spiders so that we're no longer indulging in that catastrophic thinking or other forms of cognitive bias, such as the memory bias. Then, once we've got everything we need in terms of the cognitive component, then we do the behavioural component, the second step. This is a bit easier. This is where we identify how those thoughts and feelings are triggering maladaptive behaviour. And we look at what that maladaptive behaviour is. Again, this might require the use of a diary or conversations with a therapist in a clinical setting. So we're identifying when we've indulged in avoidant behaviour, social withdrawal, we're losing sleep, we're indulging in substances, we're being aggressive, etc. The third and final component is we bring the behavioural and cognitive components together. Because after all that work we did during the cognitive component, now when we see a spider, think about a spider, when we're planning to go out and we're mindful that we might be exposed to a spider, we're now in position to basically exercise that cognitive restructuring. And so therefore, by no longer exercising that cognitive bias, now we're able to generate more adaptive behaviour. So we're able to blunt our aggression. We're going to push ourselves to be more socially active. We're going to basically endeavour to maximise our daily functioning. We're going to cut back on the substances, etc. So again, this has three stages to it. Step one, we have a cognitive component where we appraise the triggers, the thoughts and feelings about our phobic stimulus. Then we learn to cognitively restructure, which requires a bit of work, a bit of education, a bit of intervention. Step two, we move on to the behavioural component where we identify what that maladaptive behaviour looks like. And then step three, we bring it all together so that we're able to move down that positive end of the continuum and no longer demonstrate that avoidant maladaptive behaviour.